Greetings. This is the base case of the hip-hop model. I want to run through the parametric settings just to make sure that we have what we think we have. I'm going to pull this all the way across here just so we can observe what the times are, because making sure that you have the base case is going to entail verifying things like inter-arrival times, the number of surgeons in each pool, and things like that. All right, so patients are arriving every 90 minutes for patients A and also for patients B. Then registration takes place in 5 minutes with a standard deviation of 2 minutes. That's true here as well. Then we seize the OR. Let's have a look at how many we have in the registrar pool. There's 2. And then for the seizing of the OR, we're grabbing from operating room pool A, and when we seize from B, let's just verify that we're grabbing a resource, an operating room from operating room pool B. So these are the 2 operating rooms in question for grabbing an OR. So these folks grab from track A, they grab here, and then track B grabs from operating room pool B. Then we grab an anesthesiologist, and notice that I'm grabbing from anesthesia pros A. That's a resource pool here. There should just be one anesthesiologist at that time. Now, not distinguishing here between what the qualifications are. These could be anesthesiology assistants or CRNAs or anesthesiologists. For the purposes of this model, we're going to simplify this. The first hire would have to be an anesthesiologist, but after that, depending on risk management of the hospital group and also of the laws applicable, you would be able to add folks with maybe lower credentials than what an anesthesiologist and entitlements than an anesthesiologist has. Okay, so that's the anesthesiology pool. So I just want to look at the operating room. We have 2 of each, 2 ORs in each. We've grabbed the anesthesiologist in A. I just want to make sure that we're grabbing from the correct pool here. That's correct. Anesthesia pros B, and we just grab 1. And then we're going to go and sedate. So this is a time, and it's a mean of 25, a standard deviation of 707. Just verifying that's true here also. This is laborious work. And make changes, and maybe back out of these changes so that you're not rolling multiple changes into one analysis, because you really want to be able to tease out, if I do make this one change relative to the base case, what is my delta? So in the surgery, I'm going to grab one surgeon from, here it is, one surgeon from surgeon pool A, and the surgery takes 100 minutes, 100.71 minutes with a standard deviation of 8.09. That's from the published paper of Dr. Paul Kanuja. And then surgery B, same thing, but grabbing from surgeon pool B, so from here. And then that takes 100.71 minutes, so that's correct also. Okay, so let's run across here. We're going to release the anesthesiologist. We're going to stop our timer. Then we're going to clean the OR. And cleaning the OR, we need a resource there from EVS pool, 1 person. There are 2 cleaners and 2 people, professionals in that EVS pool who return the OR to a ready state. Let's verify that that time is consistent here also. So it should be, let's see, this one was 15.5. This is also 15.5. If you have better information from published work or from personal experience, you can motivate changes to these times. The ones that I want to use as the base case, fix as the base case, the only ones that absolutely need to be fixed are the surgery times here, because they come from Paul Kanuja's paper. If you're going to innovate there, that counts as an innovation. So you could, for example, argue for some sort of lean innovations like standardization, training, and so forth, that may reduce variance or maybe even reduce the mean times. Right, then we just release everybody and we sync. So that looks good. So let's go ahead and run our base model now. And I just go ahead and hit the green button here. It pops up. Now I'm going to click on this little gear, and I'm going to plug in a limit because I don't want to run beyond 570 minutes. You actually have to hit enter so that you get this in red here. That's going to be the limit of our day, and it's going to stop there. Now you can see that it's running at 1x. So what's happening is patients come in, they grab an OR, they grab an anesthesiologist, they get sedated, then the surgeon kicks in. So ultimately, I want you to notice in this process where the surgeon is involved, and it's really only here in these two tracks. The anesthesiologist is involved from prior to the sedation to being released here. So the anesthesiologist we're expecting should have higher utilization than the surgeon, because the anesthesiologist has to be present during the surgery as well as during the sedation, whereas the surgeon only has to be present during the surgery. The OR has even higher utilization because it has to be in hand by the patient, so to speak, prior to sedation. So it's in hand for the sedation, for the surgery, and also for the cleaning. So that's how we're expecting these things to play. So imagine how this day plays out. First patient comes in, gets an OR, gets an anesthesiologist, gets the surgeon, starts the surgery, and things start, the utilization start increasing because they're now working, have worked a larger fraction of the day to date. You can see a patient has completed surgery here, and you can observe that here where a patient came in and actually completed surgery. That's the second patient is now getting sedated, and has completed sedation, has started surgery. Now you see a little kink in the graph here because the surgeon is no longer needed in that pool up here briefly while the second patient is sedated. Now this second surgery has started, so you can see how that's increasing. The operating room was briefly, two operating rooms were briefly in use because we completed the surgery. That operating room went on to get cleaned, and then sedation started in the second OR. So both ORs were in use while the second patient was starting to get sedated and while the first OR was getting cleaned. And then once that cleaning or the sedation occurred, then utilization starts to drop off because one of the OR where the second patient is, of course, is being used, but the second OR is now clean and is idle. So this drops off. Second patient is in surgery here. Notice how the anesthesiologist is basically pedal to the metal, 100% utilized. All right, so you can see there's one completion up here, actually maybe two. Right, two have, no one has completed surgery. All right, now you're going to see little kinks in these graphs at the point where surgeries end. At the point where the surgery ends, the surgeon's utilization is going to drop off. And then for a brief time after that, while we have sedation and cleaning going on simultaneously, the OR is going to increase utilization. And unfortunately, the anesthesiologist never gets a break here. All right, so I'm going to speed this up a little bit. So you can see I'm at 5. So we're now cleaning or sedating in the OR. And it just ended. Now it's slipping off. You can see the third surgery has started here. And the anesthesiologist continues to be heavily utilized, now going to 98%. Notice how the surgeon is now down into the 80s, but does climb into the 90s. You've also got some confirmation about how this is playing out here in the color coding of these resource pools. So we've done 3 surgeries in each. How do I know? Well, I've got 3 bars here. Those are the completion times for the surgery, about 125 minutes in each. All right, so we're at 400 minutes for the day. I've only done 3 surgeries. I'm kind of in trouble here. Probably not going to get to 6, right? I'll just run it all the way through. completed 4 in each. And here we're coming up on the end of the day. The 5th surgery has started. Will we get it done? A close call. All right, we got the 5th one in track B, but not in track A. Only got 4 done. This is one-time evolution, right? And we'd have to go ahead and simulate this again. So what am I recording here? I'm interested in these utilization numbers. The bottleneck would be considered these anesthesiologists, about 94-95% utilization, followed by the surgeons. And then the operating rooms are utilized about 60-61% of the time. Remember, there are 2 of them because these, there's alternation. So about 61. So they're not the bottleneck at this point. And I'm going to run one more time for you, and I'll run it faster. But I want to go and change. I go to projects, and I go to simulation main for the hip hop model. Just change the random seed. And I'm going to make this, let's say, a 7, whatever, just something different. Run it. And I'm going to run this one faster to completion. You might spend some time just rationalizing how this thing should go, but I think it's clear that the anesthesiologist is typically going to work all day without a break, because as soon as the one surgery is done, they're back sedating the next, and then they get started right at the beginning of the day after registration. So they got a 5-minute break at the beginning of the day, and after that, it's work all the way through the rest of the day. The surgeon gets a break while sedation is occurring. And the ORs, there are 2 of them. They're both in use while one patient is being sedated and the previous patient is being cleaned. The OR is being cleaned from the previous patient, but other than that, it's sort of an alternating gig. So let's set this up. 570. And then we'd go here. Well, now the graph doesn't show all the time evolution, just the last little bit. So, if you do want to see how this thing unfolds over time, you are going to have to run it slower. So here we got 5 in track A, 4 in track B. Notice how the flow times differ significantly from what we had previously. So here on average, folks are spending 156 minutes in the process from time of arrival to time of end of surgery. And here 130 minutes, so quite different from the previous run. So I'm guessing to get reasonable estimates, you may have to do this 5 times, and even then, it may be quite erratic. But in the paid version, you can't automate this. Okay, so this is the base case.